Hi, I'm Scott.
Hi, I'm Lacey, and welcome to
Welcome
our
to our
YouTube.
YouTube channel. Just kidding. We're just recording a quick video to tell you about a quality improvement project we did called MO Central. In a simplified model of a hospital, there are two groups of people: the people that make decisions on how things should be done and the people that follow their directions. In my world as a junior doctor, I follow the rules set by the hospital committees, which are communicated with me using directives like policies, procedures, and guidelines. But what happens if this communication breaks down? It was during my term as a medical admin representative sitting on hospital committee meetings that I saw this firsthand. The committees would be revising policies that I wasn't even aware existed.
It turns out that my experience wasn't unique. Our survey of junior doctors showed that policies from local health districts ranked very low on the list of resources frequently used by junior doctors. Does it matter? Well, yes. Poor compliance with local guidelines results in reduced use of best practice, unwanted clinical variation, and therefore impaired quality of care. So what can we do about this? How can we get junior doctors to more reliably follow local guidelines? Traditional solutions to this have been variations on education. The doctors don't follow guidelines. Let's teach them more about them. Sounds sensible, but in reality, this relies on the memory and retention of an already mentally overloaded and very transient cohort. The likely outcome is that they simply won't remember, as is my case. Our proposed solution was to focus on the opposite: teach a man to fish. We reversed the information flow and focused on how to get junior doctors to seek out guidelines when they need them. Why don't junior doctors do this already? Well, actually, they kind of do. Our survey showed that junior doctors search for information about how to complete a task 2 to 3 times per shift on average, and even more frequently on after-hours shifts. The issue is finding the right resource. This is best represented by thinking about a series of barriers between the junior doctor and the guideline we want them to use. These barriers include anything that makes this process more difficult. There are lots of possible barriers, but in our case, we found an outdated and dysfunctional intranet web platform that made guidelines difficult to locate, and also found long-form written documents that were time-consuming to review. So what happens when a junior doctor encounters a barrier? They are busy working on the wards, they need an answer as soon as they can, so they look elsewhere, somewhere easier. Our survey demonstrated that elsewhere was an alternate resource, searching on Google or asking a colleague, though it's not impossible to imagine they might also just take their best guess. The survey also showed that the most commonly used resources ranked better in their usability and interface. The solution, we decided, is removing these barriers. In other words, improving accessibility. So we created a new resource platform with this in mind. The result was a series of web pages on the intranet called Medical Officer, or MO Central. Notable design features included limiting the content to only what was relevant to junior doctors, organizing it by an intuitive hierarchy of categories and subcategories, and summarizing the relevant guideline on the web page itself with a link to the full text for reference. This fulfilled our 2-click goal, where the user could see the answer they wanted in 2 clicks from the resource homepage, which was a single click from opening the web browser on any hospital computer. This meant that the resources could be found in seconds, even if you were unfamiliar with the platform or looking for a resource you hadn't used before. So, did it work? Excitingly, it has. While it is difficult to quantify the end result, which is compliance with guidelines, we had pleasing results from our qualitative survey, which showed all respondents found MO Central to be a useful resource, with most accessing it multiple times daily, and almost half rating it as their most frequently used resource. The quantitative data from the site's traffic was also encouraging, with initial click rates of 300 to 700 per month increasing to almost 3,000 clicks during the month of May, likely contributed to by the starting of the new intern cohort. It's worth noting that while the primary goal of this project was to improve compliance with local guidelines, this resource carried a parallel benefit of improving junior doctor well-being by improving access to resources, which decreases stress and uncertainty, as well as improving efficiency. So what have we learned? Reliance on education to improve compliance with local guidelines is resource-intensive, burdensome on JMOs, and ultimately ineffective. Junior doctors very commonly, during their work, search for information how to complete a task. However, they preferentially use resources that are easy to access and navigate. Therefore, Accessibility and usability of the platform where local guidelines are accessed is a vital consideration for their uptake and use. The challenges of the project included technical restrictions of the platform, the significant upfront time required for content creation, and the requirement for ongoing maintenance of the content to ensure it remains up to date and relevant. We would encourage any hospital to undertake a similar project. Should you be interested in knowing more about our project and platform, please don't hesitate to contact us. Thank you for listening.